here we go.
One more time and we'll give up.
Hi, I'm Robin. I'm going to be your nurse today.
Hi, Robin. My name is Sherry.
I wanted to, I need to do a mental status exam on you, and we're going to do a some neurological testing on you as well. Just kind of checking to see what your cranial nerves are, what your gross motor function is, and your sensations that you have, with your nerves throughout your body. Okay? Okay, so my first observation with Sherry was that when she walked into the room, that she walked in with a very steady gait. She's got equal length in her paces. She's not favoring one extremity over the other. And when she's sitting, she's symmetrical and moves both of her upper extremities symmetrically when she walks to and with her gait. Her cranial nerves, we're going to start with her first one, which is her olfactory, and we're going to test for smell. So what we would do is, I'm going to occlude one of your nostrils and I want you to breathe in. Can you smell that? And what does that smell like?
Cinnamon.
Okay, and the same thing, other side. Okay. Cinnamon. Ideally, I would try to do this with some coffee or some other essence to see if she was able to smell that, but a little of what we've got. Second cranial nerve would be the Snellen test, which is testing for her distance and her depth perception, and that would be the eye test, or for the kids with the pictures. As we don't have that, that's essentially what you would be testing for. The next tests are for her eye movement, and that would incorporate cranial nerve 3, the ocular, looking at motor, and it also tests for pupillary reaction and eye movement. The trochlear, which would be cranial nerve 4, and cranial nerve 6, the abducens, that test the oblique movements of the eye to the outer vision fields up and down, and to the upper inner field. So I would like you to move your eyes to this direction, up there, down, down, and then side to side. Okay, I'm going to put my finger out here. Tell me when you stop seeing it. Here. Boom. Okay. Did you feel that on your nose? Mm-hmm. Okay. The other thing is we would test for her visual fields test as well. Bringing my hands in, you tell me when you see my fingers peripherally. Look straight ahead. There. Right there. Okay. This side right there. Okay, and that's equal. We do the same thing up on the top. There. There. Okay. All right, so she's got adequate visual fields in all of her, they're called the 6 cardinal fields of gaze. And that tests, again, your cranial nerve 3, 4, and 6. Cranial nerve 5 is your trigeminal, and that is to evaluate her jaw and her mastication muscles. Can you clench your jaw for me? Clench it, like you're biting down on something. Okay, can you move your jaw side to side? Your teeth. Okay. All right. We're gonna, for testing the cranial nerve 7, that's the facial nerve, and then we're gonna test your smile. So I want you to smile. Okay, that's symmetrical. Round. Good. And I want you to clench your face up like it's ooh nasty. Oh, okay, good. Her face is symmetrical when she's doing each of those movements, looking at her eyebrows as they come in, looking at her eye function, her eye muscles as she's coming into, and all of those are equal. Her cranial nerve 8 is the auditory. We're testing for hearing. There are 2 ways to test for that. You can test and do a whisper test, or you can test. Can you hear that?
Yes.
Mommy.
And what about that?
Yes.
Okay. There are two other tests that check for nerve conduction, and I don't have a tuning fork, but we would need a tuning fork for that. And one of them is the Weber's test, where I would click my tuning fork and I would place it here on the top part of her head, midline, and we would be testing for air conduction within her sinuses and inside of her skull to see if she's got any conduction deficits. The other one is the Rhine test, also done with the tuning fork. And that again, I would click the tuning fork, I would place it here, turn to the side, here on her mastoid bone, and I would ask her to wait until she feels the vibration stop. Once it stopped, I would take it off, and I would put it in front of her ear to test for air conduction of that. And the purpose of the Rhine test is to evaluate the differences between the bone conduction on her mastoid bone and the air conduction that she can hear through her ear when the tuning fork is placed in front of her ear. She should have a greater sensation with the auditory because the air travels through the sound waves travel through air much faster, and she should have a greater sensation with that. Cranial nerve 9